Mungai. I'm a nurse by profession. I'm working in Lualaka sub-county, and I'm part of the rapid response team for COVID-19. Thank you very much for this session. I just want to encourage you that in this COVID-19 pandemic, we need to remind ourselves of what we need to do as children to take care of ourselves, our families, and our other children. COVID-19 is a viral disease, and the viral disease that came in the year 2019, and since March in this country when we had the first case, it has continued to spread to many other people. COVID-19 has no cure, and COVID-19, we need to do all the preventive measures that the government is telling us so that at the end of the day, we protect ourselves from contracting the disease. Now, as you go around your duties, as you stay at home, as you go to church, remember, you have to keep a few things and you have to understand why you should take care of yourselves so that you take care of your families and the other siblings. What are some of the signs and symptoms that you need to look out for? With time, there are many things that have changed, but there are major side effects, signs and symptoms that you need to look out for. You look out for high fever, that is hotness of the body. Some of us will get diarrhea. You have loss of taste. You have loss of smell. Some of us will feel general weakness of the body. And then when you get some of these things, you can also have somebody complaining of difficulty in breathing. They are not able to breathe properly. So please don't ignore children. Don't ignore. Tell your parents so that they can be able to assess and take you to hospital early enough. The more you get the symptoms, the more you keep the symptoms, and especially the difficulty in breathing becomes very complicated, that you find yourself having to be put in a machine which will help you to breathe, or even get oxygen, which is a very grave stage. So please be on the lookout. And when we are talking of the signs and symptoms, I also want us to look at what as children and everybody in the community needs to do. And we want you to be ambassadors of this. That when you are outside your home, please put on your mask. And when you put on your mask properly. Make sure you have covered your nose. Make sure you have covered the mouth. And don't remove your mask when you're out there in the public. Don't remove your mask when you're in the church. Don't remove your mask when you are meeting with the other MYM or other children. Please keep your mask on, because you can spread this disease by when you speak, you have droplets getting to the other person. When you speak or you laugh, then you can also have the droplets reach the other person. So put on your mask and make sure you have your mask properly on. Then the other thing that you need to do is constantly continue doing hand washing. Hand washing, as we call it, hand hygiene. You need to wash your hands with soap and running water. And you wash your hands with soap and running water for at least 30 seconds so that you're able to take care of all the areas of the hands. That every part of your hand, the fingers, the palm, the wrist, all of them are well cleaned. Make sure you are using soap. Then, if you are moving out there and you don't have the soap, please carry a sanitizer. Sanitize as many times as you can. When you touch surfaces, if you're traveling in a matatu, you touch the seats, please sanitize your hands. If you go touch desks or touch something, touch somebody else's pen, please sanitize. And make sure at the end of the day, you have taken care of your hand hygiene. Then as we interact with each other, please make sure you also keep social distancing and at least 1 meter apart, so that as you speak, as you share, don't hug, don't shake hands. Make sure you're talking to one another with at least a 1 meter distance, so that you protect yourself and you protect the other person. When you are in your meetings, in the MYM meetings, we are encouraging you to sit outside. If it is in a closed place, there must be social distancing and at least not more than 20 people in one room. Then, when you're outside, make sure you also keep the social distancing. Outside is even better because there is air circulation and it will help you. It will help everyone who is out there to have fresh air coming in and going as you interact, maybe in your meeting or maybe in a session that you have asked somebody to speak to you on a topic. Please try and sit outside. When you go for meetings and when you go for birthday parties, encourage each other to sit outside. Sit outside because it is safer when there is a free flow of air. And also, don't forget, keep the social distancing. Now, as we talk of COVID-19, please also learn to eat healthy. Eat healthy, do exercises. Please don't eat a lot of pizza and forget the vegetables and forget the fruits, forget drinking water. Please eat healthy. When mom says you eat the vegetables, please eat. When mom says eat the fruits, please eat. And remember, when you eat healthy, you improve on your immunity and your body is able to even fight off the viruses. And they may not be as severe as they are. Remember, we have said COVID-19 is a new disease. It's a viral infection and it has no cure. But we can protect ourselves, we can protect others in whatever we do. Take care, take care, take care. God bless you. So, my dear children, as we take care, remember some of the people will tell you there is no COVID. Me, I am in the hospitals and COVID is there. Many people are sick. Many people are even dying because of the COVID-19. Please, we must take care. If you must not go for a sherehe, if mom says don't go there because it is crowded, because there are many people who are going to be there, please don't feel bad. Let us celebrate in our small way in our families and let us respect that. And as we take care of ourselves, remember, we are also taking care of the others around us. Don't insist that you should go to Shosho if mom says you should not go, because Shosho could be having another condition like diabetes, hypertension, and we are saying these are grandparents because they have other conditions. They have a higher chance of contracting the COVID-19, and as we say, some of us will have the COVID-19 and they will have no symptoms. So you may not know until you are tested. If you have no symptoms, you could be having the COVID-19 and you cannot know. You may also infect others unknowingly. So let us take precautions. Let us take all the measures that the government is telling us to do, and let us also respect what our parents are guiding us in the prevention of the COVID-19. If you have any questions, you can talk to your teachers. They'll ask your questions, and I'll be able to answer them in due course. Thank you very much.